Chilczuk, and I'm going to be sharing with you a little bit about myself and my desire to possess a career in the medical field. I am currently a sophomore at Seattle Pacific University, and I'm majoring in applied human bio with the intent of becoming a physician's assistant. In addition to studying at SPU, I also play for the women's soccer team. And my dad's from Argentina, my mom's from Brazil, which are two countries that are really focused in soccer. So I've been playing ever since I was little, and integrating soccer into college and studying just seemed to fit. And it also gives me more ways to be involved with my school and allows me to develop skills like teamwork and time management. In my spare time, I enjoy volunteering, hiking, and even cooking. In general, I just like activities that involve connecting with large groups of people, and my passion for helping others through medicine really stems from my childhood within the diverse community of Kent, Washington, and my experiences later in life. So, from a young age, I always knew that I wanted to go into the field of medicine. Um, I was always curious about the functions of the human body and how these systems kept us alive. I was really intrigued by this. And growing up, my father, who is an orthopedic surgeon, would answer any questions that I inquired regarding the anatomy or the physiology of the human body. And he naturally encouraged me to go into the field of medicine due to this curiosity. And I remember frequently visiting his office and going room to room, looking at all the medical activities taking place. For example, I would see like doctors, nurses, physician's assistants, all working together to help patients. And this is what really sparked my interest in medicine. But unexpectedly, I realized my specific role in this imperfect science just this year. A couple of months ago, I sustained a broken leg during a college soccer game, and I truly believe that this unfortunate injury happened for a reason. And I hadn't really been injured before, so this was kind of new to me, and I had so much time on my hands. I was so focused in school before breaking my leg that I just never had really time to think. So after I had this injury, in my recovery time, I had so much time to think. And so I explored like the meaning of life, considering I had so much time on my hands during my recovery. And I realized several things that furthered my desire to go into medicine. I realized first that life in itself is a miracle. The way our body systems work all together and in like a coordinated fashion to keep us alive fascinates me. And I really thought about this during my recovery for some reason, just life and how people take it for granted and all that. And it goes on to show that I also looked into the various organs in our body, to the microscopic cells that make up our body, all work in a coordinated system that allows us to move, speak, and think. And it is tremendously meaningful to me, this idea that our body is capable of keeping us alive for so long by these systems that work all together. And I also realized how lucky I was to be treated for my injury with such care while other populations are not as fortunate. Through my recovery, I have learned to appreciate the significance of every individual, whether within our world, and like how everyone is just worthy of a healthy life, regardless of their situation, regardless of their class, regardless of the social determinants that impact them. I just really want to help everyone have the best life they can, essentially. And with all this being said, my experience growing up and my injury have led me to realize that I want to help others. My passion for learning about the human body, as well as my desire to care for individuals, have uncovered my role in the medical field. I want to educate, connect, and serve others, regardless of disparities between populations. And these three aspects revolve around interactions. And my longing to become a physician's assistant specifically is because of these interactions. Just because I know that physician's assistants, as compared to medical doctors, have more, I think, like more hands-on, one-on-one time with the patient, rather than just like the doctor going in to see them and then doing whatever they needed and then leaving after that. I think with a physician's assistant, you have more personal connection with the patient, which is what I want in a career in the medical field. So I think physician's assistants are, it's like a perfect profession for me specifically. And from my understanding, just physician's assistants are able to interact with patients at a deeper level, while still being a part of the close care that goes along with treatment. So a health profession exemplifies my desire to educate, connect, and serve others. Helping others live the best life they can is the driving force behind my goal of becoming a physician's assistant.